So we'll get started, ladies and gentlemen, if you could take your seats. Okay, we'll get started. Welcome everyone to this 19th meeting of the Board of Health. For this term, we have 16 items on today's agenda with registered speakers for items 1 and 16. Just to get started, a few good little things. Yes, it is spring. We finally can announce that. This is the first meeting of our new Medical Officer of Health, Dr. Davila. So welcome to this great body, amazing board, the Board of Health. It's also the first meeting of Councillor Nathan Shan, so welcome to this committee. The way I sometimes put it is you can change the world through public health if you're smart and if you have the patience to wait and be persistent. So for those of us in the room with us, the screen at the back of the room provides real-time updates concerning where we are on the agenda and what's coming next. You can follow the agenda and debate on your computer, tablet, or smartphone at www.toronto.ca/council. The Board of Health gratefully acknowledges it is meeting on the traditional territory of the Mississaugas of the New Credit First Nation, the Anishinaabe, the Haudenosaunee, getting there, the Wendat, and home to many diverse Indigenous peoples. Just before we get started as well, this is a happy occasion, but a little bit of or call it a transition moment. We have two people who have announced, both have announced and one has already retired. Shirley Mcpherson is no longer with us. She was the Director of Finance and Administration. She has retired. She's not here at this meeting. And if you could, all of you, each of you, pass on the Board of Health's thanks for the great work that she did. She was one smart financial cookie that helped us get through many a difficult issue at the board. So we are thankful to her and wish her the best in retirement. And Jan, I see you nodding. It would be great if you passed on our best wishes to her. Secondly, I'd like to acknowledge that Dr. Monica Campbell, Director, Healthy Public Policy, on her retirement at the end of this month, and this is, where is she? There you are. This is her last meeting of the Board of Health. I've had the pleasure of working with Monica over these past years as the board chair and as a city councillor, and I know I speak for all the board and all of city council in saying that her departure will be a loss for our organization and our city. For those, just to recap who she is and what some of the things that she has done, Monica started in 1988 with the former City of Toronto Public Health Department in the Environmental Protection Office, and then moved to North York Health Department's teaching unit 4 years later. At Amalgamation, 1998, she became a manager in the former Planning and Policy Directorate. Through her leadership, Public Health has made groundbreaking changes to protect the environment and reduce the impacts of climate change. More recently, as Healthy Public Policy Director, Monica led the HPP team on major reports to ensure health policy is included in city building and transportation design, and ensured City Council was able to consider the health impacts of major decisions such as casinos and island airport expansion. And I think that was her real gift, was to apply a very serious public health methodological discipline to the work, but from that able to comment and to add value to other debates that the city was having, be it in the area of planning, transit, or in the case of casinos, social development, and so on. And that was a real skill, and I really speaking on behalf of the board, honor you for that skill. I think at the end of the day, Monica has helped make the City of Toronto a healthier place for us all. for future and the current generation for future generations. On behalf of the Board of Health, please help me in wishing Monica all the best for a long, wonderful, and well-deserved retirement. Monica. Did you want to say something? Okay.
What I would say is thank you very, very much for the recognition. Of course, the accomplishments that happen in my directorate are very much contingent on the work of my team. But I think our success, our collective success, was very much dependent upon really helpful support by the Board of Health and the kinds of decisions that you made. I would say I was kind of checking our track record. I think 95% of the time when we put recommendations before the board, we had those adopted or strengthened. Had a few losses in there, but I knew that we and people in my directorate can count on the board to seriously consider the kind of recommendations we're making and to adopt them. Thank you.
Okay, so we'll go through the agenda in rapid order and then return to the ones that are held. So perhaps for Nathan, if you want to hold something, just feel free. Otherwise, we kind of do this fairly quickly. So 19.1, healthy aging in Toronto, the health status of seniors. We do have one deputant, so we'll hold for deputations. 19.2. We need to hold that. It is the 2017 Board of Health Committee and Governance Update. 19.3, Modernization of Ontario Public Health Standards. Does anyone want to hold that? I do have an amendment that was worked on with staff. We could, is it Stella? Are we, if it's ready? In the process. Feel free to, if you want to hold to read it more thoroughly, that's fine. Okay, seeing no concern to hold it. Moved by Councillor Doucette. All in favor, opposed if any, that's carried. 19.4, 2016 Annual Report, Toronto Public Health. Great document. Move to receive it, Councillor Layton, all in favor, opposed if any, that's carried. I'll get you next, Joe. 19.5, reducing vulnerability to extreme heat in the community and at home. Anyone to hold that? I do have an amendment to that to include TCHC in this work. If we could put it on, just to take a quick look at it if you want. Put it on. Board, please, Della. Staff are doing this, but I think putting it in the motion would strengthen the work to make sure TCHC and other social housing providers are also looking at heat and extreme heat and how to deal with it, especially given that it's our company. Okay, all in favor of the motion and the report that is before you? That's carried unanimously. Thank you very much. As amended, yep. 19.6, perinatal mood disorders. The request here is it's an information report. Any hold? Okay. Okay.
I will move that one as I am a female, a woman, and have probably gone through some of these things. But it's a very good report, so thank you.
We'll do no gender appropriation here.
I'm sure actually everyone could go through these things. So.
Okay, moved for receipt by Councillor Doucette. All in favor, opposed if any, that's carried. 19.7, Student Nutrition Program Governance Update. It's a short report, it is an information report, but I know that a lot of folks sweated this one out, so thank you for that. Move it? Okay, yes, moved by Trustee Glover. Yes, okay. Well, I knew it was trustee Glover, but you know what, your name is not, you're out of seat. Okay. All in favor? Opposed, if any? That's carried. Trustee Glover, I think you want to do the next one as well, or you might even want to comment on it. We're at $12.5 million from the city to the to school nutrition in, frankly, all 4 boards, and we're almost there with our 20%. So do you want to move it or say anything? Anything? Okay, so does anyone need to speak on it or hold it? Okay, so why don't we give you the floor and you can say what needs saying.
The motion where we're discussing the Toronto Foundation for Student Success, and in it there was a bit of history about where the Toronto Foundation for Student Success came from, and it dates back to 1998. And in 1998, the funding for this program and the extent of this program was a fraction of what it is now. And so I want to, on behalf of the TDSP and the Toronto Foundation for Student Success, I want to extend our thanks to the city for all the support that they give to our students every day.
Thank you. Any other comments? Just because it's a money piece, so we are now at, this year in 2017, we're at the 18% of what we at one point figured out what the cost of a fully funded program would be. We're at 18%, and if all goes well, fingers crossed, we'll be at 20% in 2018. So we will have done what we perceive to be our role, which is 20%. We're looking to the provincial government for its 20%, and you know what, to their credit, they've been fairly good partners on it. We're a little bit ahead of them, so now the ball is in their court to basically play catch-up to us. Then is the federal government, and I can say I've gone to meetings with some board members and certainly with a number of staff, to anyone that would listen to us at the federal government to try to get a national student nutrition program. That has not happened yet, but conversations are ongoing, and there are groups from British Columbia to Newfoundland that are pushing in the same direction. Alberta is especially keen on getting this done as well. So we have done a lot of work in the last 10 years, and it's been a great partnership, and I think we've done our kids good. And I think it's from all the indications that I've had, even from some reports, is that it's changing student outcomes as well. Everything from behavior and also learning outcomes.
Can I make one more comment? Sure. I can't speak to the data. I know the data does show that it's improving student outcomes. I can speak from visits to schools where I go in, and I was in one school, Dixon Grove, recently, and they have volunteers preparing hot meals for the children at least 3 days a week, plus the snack program. And the fun part was the police come once every couple of weeks and serve the food. So it's so neat to see our officers in hairnets. They bring food, but the beauty of it is, like, the city's a partner here, the province is a partner here, but it's the whole community come together to make sure our kids have food in school. So thank you.
That's great. Okay, thank you. Okay, Della is such a good assistant here. Are there any declarations of interest under the Conflict of Interest Act? Okay, and we also need to confirm the minutes of March 20th, 2017, moved by Lisa. Okay, all in favor, opposed to any? That's carried. Okay, thank you. Thanks for reminding me. HL 19. Oh, did we pass the subsidy? We need to vote on it. Okay, so moved by Trustee Glover. Again, seeing that he's from the school board. All in favor of 19.8, that carries unanimously. 19.9, Toronto Public Health Accountability Agreement Year-End Indicator Performance. This is for receipt. Moved by Paul. All in favor, opposed to any? That's carried. 19.10, Toronto Public Health Operating Budget Variance for the 12 months ending December 31st, 2016. Moved by Councillor Shan. All in favor, opposed to any, that's carried. 19.11, Toronto Public Health Capital Budget Variance Report for the 12 months ending December 31st, 2016, moved by Councillor Cressy. All in favor, opposed to any, that's carried. 19.12, it's giving us notice that the City Council approved the Toronto Public Health 2017 operating budget. Now, they tweaked it a little bit, and I think for good governance purposes, our job is to confirm it. So I've got a motion to do the following. That the Board of Health confirm the Toronto Public Health 2017 operating budget. Any debate? All in favor? Opposed, if any? That's carried. 19.13, City Council approved Toronto Public Health 2017 to 2026 capital budget plan. That's for receipt. Moved by Stacy Barry. All in favor? Opposed, if any? That's carried. 19.14, service agreements awarded and executed by the Medical Officer of Health for 2017. Very important report showing our partnership with community agencies. Moved by Councillor Doucette. All in favor? Opposed, if any? That's carried. 19.15, air quality in the TTC subway system. Happy to move it. Okay, all in favor? Opposed, if any? That's carried. Last but not least is 19.16, and that is it has a deputation, Joe. So I know you have a motion as well. So we'll wait for that. So the items that we have left are number 1, number 2, and number 16. Is that right? Okay.
Yeah, that's correct.
Okay, number 1, number 2, number 16. Great. Okay, so we can go right to deputations, right? We don't have to wait till 2 o'clock. No, we don't. Okay, so we can go right to deputation. So we have one deputant whose name is Derek Moran. I hope I got that right. Is Derek here? Derek going once. Derek going twice. Okay, taking it into committee. Any discussion here? There's some good recommendations. From dental care to holistic things. Okay, moved by Nathan Shan. All in favor? Opposed, if any? That's carried. Number 2, Board of Health. Well, just because we're here, Board of Health committees and governance updates. We need to do a couple of things there. I think one of them will be pretty easy, and one of them I'm going to have to twist some arms. Who's not here? Okay. So we need to select members for a variety of committees. Budget Committee, Performance Appraisal, of the Medical Officer of Health. Oh, we did that one? Okay, so that's done.
We need the MOH Performance Appraisal Committee.
That's right.
Yeah.
Okay, so the Medical Officer of Health Appraisal Committee, the Public Health Champion Award Selection Committee, and the Alpha Board of Directors and Board of Health section, and also to pay for it if it's a citizen member. Peter, I understand you're open to continuing on Alpha?
That's correct. I can continue on Alpha. It's a very exciting board, and we encourage all the other members to get involved and come to the conference upcoming in June.
So there's 2 pieces there. One is you want to continue on the board, so you want to undersell it so that no one puts their name forward. Okay, but so you'd like your name forward? Yes, I can. Okay.
Anybody else would like to? I can step aside.
Anybody else? Okay, so let's just hold that. So we'll put Peter on for the Alpha Board of Directors and Board of Health section. And then on the Budget Committee, we've done Performance Appraisal of the Medical Officer of Health. Now, we have a new medical officer of health, so just and she is doing a document that we will review that forms her baseline. So normally what we would have done is reviewed the medical officer of health for last year. Obviously, we had an interim position that Barbara Yaffe filled tremendously well. So we don't have to do an evaluation of that part. So the committee that is going to be part of this evaluation will do its work, frankly, in 2014. Sorry, 2018. 18. I thought 18 and out came 14. Does that ever happen? So we need 3 or 4 members for that. I'm happy to continue working there. Councillor Doucette, we could use 1 or 2 more. Stacy, great. Anybody else want to learn the trade? Nathan, thank you very much. Councillor Shan. Okay, so we have our 4 there. And then the last one is the 2017 Public Health Champion Award Selection Committee. We did that already?
Yes.
Okay, so we don't need to do that. Okay, so we will amend the motions to include the names that we have indicated under number 2 and under number 1 for the performance evaluation. And then, Peter, you want to speak to how great Alpha is and that there's a conference coming up this fall. And why is it important for us to go there?
So Alpha is the Association of Local Public Health Agencies, and they provide assistance on governance. I think it's a great opportunity for our Board of Health members to meet other Board of Health members. There is also a section on the medical officers of health, and we have good interaction with them as well. So I think we learn what actually is going on in the province and in Canada as far as governance goes with regard to Board of Health. And I think everyone is welcome to come. And I think that the Public Health also supports any member who wishes to go. I think that's correct. Right?
Yeah, that's right. We'll, if you're a citizen member, and I guess that including the trustee, we will pay for your expenses. I think the next one is in Toronto, so obviously you wouldn't need to.
Yeah, I think it's in Cambridge or Western
Cambridge.
Ontario. Yeah.
Oh, Chatham. Okay, so downtown Chatham. So this is your chance. So if you do want to, then just indicate to perhaps Jan Houston, and we can make that happen. I too want to encourage folks to. I've been to a few over the years, and they are really helpful places of furthering our work and becoming better Board of Health members. Okay, so we have the motion together.
Adopt the report as amended.
Adopt the report as amended with the names put in. Moved by Councillor Layton. All in favor, opposed if any, that's carried. Okay, now we're on to.
Chair, can I just ask, could we just circulate the next meeting of Alpha so we know where it is and the dates and things in case anyone on this board does want to book the time and go?
Yeah, we'll do that.
Thank you.
Okay. Okay. Great. Okay, last but not least is 19.16, implementation resources for the Toronto Overdose Action Plan. We have one deputant, Gary Thompson. Going once, going twice. We're going to finish by 1:45. Gary? Oh, there you are. Okay, Gary, come. Yep. Nice to see you, Gary. You have 5 minutes, as you know.
Question came up asking Mr. Hoskins' staff about getting intergovernmental agencies like housing involved in the addictions. And that's a great idea because, you know, it's a social determinant of health, all this housing, et cetera.
Right.
And the ministry says it stands behind its October 12th statement on the overdose, et cetera, policy. We still haven't seen any action for the safer consumption sites yet. It's a mess. And also yesterday at the LINS, harm reduction was at the very bottom of the pile. Not much funding going that, and harm reduction saves the taxpayer. Every dollar you spend on harm reduction saves the taxpayer $4. So any safer consumption sites are just going to be a good idea. Faster the better. And so I asked one question when question time came up. I asked the panel, a family member has these signs: coma, labored breathing, cyanotic, pinpoint pupils. What first aid treatment do you want ASAP? Not one of the panel members said a word. Complete silence. So anyone in first aid knows that's signs of a drug overdose or any respiratory emergency. You better be giving them air. They can't even save their own family members' lives, nor their souls. Utter nonsense. You should stop teaching that chest compressions only for drug overdose in 22 health districts in this province. It's costing you a fortune because a doctor or paramedic or a nurse can't tell the cause of respiratory emergency, but knows to give air ASAP, diagnose, and treat later. When you empower lay persons what they think is a life-saving technique, they're only too eager to go out and do it. And it's happening. Because a lot of these people, these disenfranchised, travel by foot. And they're in the subway system. And there's a gas goes up and people run the other way. They're running towards it. Just trying to save lives and the taxpayer fortune. Simple. Don't know why I have a problem. I could tell you a little story how it increases drug abuse too. I was taking a course, Salvation Army, about social work. One of our teachers was an addictions counselor. Salvation Army had in the front window a Toronto Public Health chest compressions for drug overdose. When he became aware that it was the worst thing he could do, he went on a drinking binge. Him and his wife both worked for the Salvation Army. His wife growls at me. I says, look, take that silly sign down because you're making everybody sick. The teacher of theology that we had in this course first started off in chemistry at the University of Toronto. Every chemist knows any poisoning, any drug overdose, give them air. The minister also has multiple sclerosis. When his muscles become too weak to breathe, he'll be put on a ventilator. And every minister knows the end of life training from their theology courses. People that are kept comfortable when they're terminally ill. They're overdose narcotics. Every minister has been trained in this to explain to the family members what happens. Person stops breathing. Heart doesn't stop until they're brain dead. Thanks a lot. Have a great day.
Thank you, Gary. I think you'll want to probably hang around on this conversation.
Oh, yeah.
Not here, but
Questions, right.
are there any questions of the
There has
deputy?
been before.
Okay, there are none, but I know that Joe's going to, Councillor Cressy has some comments on the letter that he submitted, so you'll probably want to hear that, but I'll invite you to go back to sit with the audience.
Oh, yeah, right, thanks.
Okay, great.
Thanks,
Thank you,
Joe.
Gary,
Have a good one.
as always. Okay, so this is Councillor Cressy's letter as the chair of the Toronto Drug Strategy Implementation Panel. Councillor, okay, so we'll start with questions of staff.
Just a few questions to make sure we're on the same page. So to our MOH. So this Board of Health did in fact endorse the Overdose Action Plan as presented in March, right?
Yes.
Okay. So as part of that Overdose Action Plan, staff had identified that $374,000 was necessary to complete and do the work. Now, the recommendation had been to wait until the 2018 budget process to determine it, but in order to do that work without stopping doing other public health work, $374,000 was identified as needed. Is that correct?
Yes, more or less. It's around 374 and then some, but that's a reasonable estimate, that's correct.
Okay.
For 3 FTEs.
And so can I just check that amount. That was $374,000 that was identified. Given that we are now in May, and it would take time to hire those 3 FTEs, how much money would be required if a motion was moved today to do that work?
So I think it would, through the chair, it would depend on when exactly we would bring people on board, but you can imagine that that's a costing on an annual basis, right? We would have to prorate relative to the amount of time, right? So if you can bring them on in June, that's half a year, it's half the amount per FTE.
Okay, so, but I'm just want to make sure. So I've been advised by staff in Toronto Public Health that that amount would be 117,000 gross that is required.
Gross.
Yeah, so 100, well, and it's cost shared, so it would be 44,000 net. So is it
That's about
correct that we need 117,000? So we don't need 374,000 to start the work today for 2017, we need 117,000.
If we're looking at about half the year, that's about right.
But so just for, that's,
A third of the year, maybe even a quarter of the year. No.
Well, no, you
I'm
have
trying to
look
get the
at-
exact number from you that the board, if I were to move a motion to do this work, how much money I need to give.
Right. So it is roughly, right, we're looking at 118,000. Oh, excuse me, 107, so this is not quite right here. It's 177,000.
Okay, so after this, I'm going to ask her, because I need to
Yes,
revise the motion.
please.
So it's 177,
Gross, 177.9 thousand.
177.9 thousand gross, and how much, and net?
44.5.
Okay, I'm going to work with the clerk after to adjust something. 177.9. Can you identify what work will be completed? What are the positions required for those funds?
So that presumes, just to be clear, hiring by July 1st,
Yes.
okay?
Okay, so what will that pay for?
So that actually pays for, as per the plan and what was provided to the Board of Health back on March the 20th, we were talking about 3 permanent positions, again, starting July 1st, 2017, in order to implement the overdose action plan and to do the necessary work in support of what we're supposed to be doing.
Okay. And at our March meeting, our Board of Health, this Board of Health requested funding from the province to do this work, and we asked for a report back if the funds were not received. Have we received those funds from the province?
We have not,
Have we been given any indication that the funds are coming imminently?
no. We have been advised that they are not coming, we should not expect them imminently, that's how I would.
Should we expect them for the 2018 budget?
I think that is yet to be seen.
Okay, okay. So the province may come in for the 2018 budget, but we don't know. But we are under no expectation they're coming now.
Imminently, no, I would expect, I would not have any expectation of that at this stage of the game.
Thank you. Those are all my questions, Mr. Chair. Thank you.
Thank you. Are there any other questions? I do have one. I'm just looking at HL 19.10 and how we did, we underspent in 2016. So are we up to speed? Are we up to full complement, taking into account our gapping, achieving gapping? In other words, is there, as we start this year out, is there money already that we are not spending by virtue of gapping higher than our target? I'm trying to avoid a big fight at council, and I have a sense that there is.
So if I can, there is always, the gapping situation and hiring in a large organization such as Toronto Public Health, there is constant turnover, and you will get people coming and going for various reasons. Some reasons like maternity leave, others move on to other positions. So generally, there is money available. I would have to turn to my colleagues in the finance and administration area if you wanted to get a specific dollar figure.
No, I don't need a dollar figure. I just need to know how it's trending, anticipating that frankly, we could get a bit of a rough ride. And if it's trending that we are under even our gapping, that it'll be an easier sell.
So I'm going to turn that over to my colleagues.
So at the March 31st and April 30th, the 4-month ending, our gap is getting narrower. So we are actually meeting our targets, and we have some savings, but the savings are not as much as where we ended at year end. So we are making improvements in our hiring strategies.
Is there
And
any
we do
money
have some
there?
savings.
Do we have some?
Yeah.
Enough to argue at council that that can help pay for this?
Yep. There is room to pay for the provincial share and the city's share.
Great, great. Okay, that's good to know. That's an arrow in your quiver, Councillor Cressy. Okay, so those are my questions. To speak, Councillor Cressy?
Thank you, and I have a motion, if it can be put on the screen. And the motion, which I'll explain in more detail in a moment, but is for the city to fund this immediately and for that money to come out of the operating variance for the City of Toronto, which I will explain. I'll speak very briefly because we spent a great deal of time at our March meeting on the Overdose Action Plan. In the 2 months since we endorsed our Overdose Action Plan, the situation has become more critical, not less critical. That in fact, the number of people dying due to overdose is increasing in our city. And these deaths, as we know, are preventable. I had a 24-year-old young woman die after taking a pill, after taking MDMA, which was cut with fentanyl in a nightclub a couple weeks ago. I mean, it is outrageous, and in a city like ours, where we know that we can prevent many of these deaths, if we implement this plan, there is no moral reason to delay, none whatsoever. And so, at our last meeting, we, as this board, endorsed the Overdose Action Plan, and we didn't have the money to do the work without stopping doing other important work. So we asked for the province to cover those funds and to report back by this meeting if they hadn't. They have not. We've heard from our medical officer of health that it is highly unlikely that those funds are coming anytime soon. I have a letter in the agenda from the Toronto Drug Strategy Implementation Panel asking this Board of Health to spend the money immediately. My motion is to get that work going right away. It is $177.9 thousand gross, because as our medical officer of health said, to hire those positions by July 1 means that it's, well, we've lost a couple months, so it's not 374. Where the money comes from, and this is important, is from the city's operating variance. The City of Toronto has $26 million identified as surplus in the first quarter. $26 million. And so in a city in a city as wealthy as ours, there is no reason, not a single reason, that I can think of that we wouldn't spend $177,000 out of a $26 million variance to save lives. And I would hope that we'd be able to endorse this unanimously.
Any questions of the speaker? Any other speakers? Councillor Layton.
I'll just very quickly thank Councillor Cressy for bringing this letter forward. In the absence of provincial action on this issue, it's incumbent upon the next level of government to take up the call and not shy away from putting resources where they're sorely needed. And given that we have such a significant variance that's coming to the next council meeting, we shouldn't be shy to send council our advice on this and make it heard loud and clear. I would just say, though, that also at that meeting is budget direction for the next term of council, and we'll remember the budget direction that came and the consequences of that in the last budget may have in fact put us in a position that we can't reallocate this level of funds within the existing public health budget. So I would encourage members of the committee, as well as anyone else listening, to reach out to their local city councillor and tell them not to accept a budget freeze going into 2018, because what you're going to get is more cuts to programs like this, because we know that costs go up on an annual basis, and a freeze is in fact either take no new action to solve any of the crises that we've been building plans to fight, in fact do quite the opposite and take steps in the opposite direction to further cut what are already stretched budgets. So thank you very much, Councillor Cressy, for bringing this forward. It shows it's an opportunity for our city to show leadership on this important issue.
Thank you. Anybody else? Okay, so you have so is that the entire motion, or are you also moving?
This can replace it.
This is replacing it, yes, okay. Okay, so this is the motion.
This is the motion.
Okay, so, okay, any further debate? Okay, all in favor of the motion? Recorded vote? Oh boy. It's unanimous. Okay. Stacy Berry, Counselor Chan. Trustee Glover, I'm looking at the name tags. Counselor Cressy, Counselor Doucette, Counselor Mahevik, Elisa Levy, Paul Nagpal, Counselor Layton, and Dr. Peter Wall. That's unanimous. Okay. Motion to adjourn. All in favor? Opposed, if any? That's carried.
We have a budget meeting at 3:30.
Can we do it?
Board of Health report couldn't have gone.
If you're on the budget committee, you have to come back at 3:30. It'll take 5 minutes. We can't do it now.
Yeah, it's been published.
Not
at
even if all 5
3:30.
people?
Of course, the first
No.
presentation on it. I didn't do a presentation.
We thought this meeting would be.
It'll take 5 minutes. Yeah.
Yeah, we'll come back here. It says 3:30, right?
Yes.
Yeah.
Okay.
See, this is the trouble that we have.
Could you say it sometime?
Barbara wants this over with. She wants it over with. Right? Well, we'll see what the quality is next year. Oh, Eileen already has an idea of what she wants, and it's nothing like this. What she wants? She wants a dashboard. She wants evidence to show where public health is going and that we are prepared